Andy. So I'd like to turn to Debbie to ask her what barriers she sees as the biggest issues facing the HIV positive trans community in the district.
Thank you.
So can you tell us your thoughts on what barriers the HIV positive trans community faces in the district when it comes to accessing health care?
Wow. There's a lot of answers to that question. Sitting from where I am and the work that I do. But the first response that I would have to think of is really home. Because that's what I see a lot. And a lot of times it's just hard to convince somebody how important healthcare or HIV or mental health care is important when they're facing homelessness.
Yeah.
So that's a lot. That's where we face a lot when we work in the transgender health now. It's one of the things we face a lot. And you have to get a person or be able to work with a person to get them to the point where healthcare seems just as important as housing. We see it a lot, but a lot of times, when working, because I work specifically mostly with the African American transgender community, and a lot of times, there are a lot of other issues that are brought into the situation from the beginning. And a lot of times, in doing the work that we do, we have to address all those issues before we can get a person to say, okay, I'm ready to address health care and my HIV or my hormone transitioning services and commit to and adhere to whatever is set forth in the plan. Because there's going to be some substance abuse issues, there are going to be some mental health issues, there are going to be a lot of issues that come along with a transgender woman. And I mean, just a lot of times, and I have to speak to particular cases, we had one woman who came in, she was homeless, she had some mental health issues, she had some substance abuse issues, and healthcare was not in the list. And that's what we do. The work we do is like, okay, we want to get you connected, we want to do a red carpet, we want to do export, and that's not important to me, Right now, housing is going. I'm trying to figure out where I'm going to speak tonight, where I'm going to eat, where I'm going to get a meal. So that's a big barrier. And a lot of times when we address those issues of mental health, substance abuse, I think we're able to get them connected to care, get them in care, being able to sustain in care. There's a lot of things because the challenges we face. Because now I feel better about myself as a transgender woman. I'm beginning to be empowered as a transgender woman. And now I'm facing this, I can't get a job. I need education. I need, and it's about empowering women, the whole world, to address and being able to get them connected to healthcare. So there's a lot that goes on with getting a woman connected to healthcare. And the other barriers now, what I'm seeing is around, I think Andy spoke on it, the exclusions. Now we're seeing a lot because at one time, I used to be able, as a counselor, I used to be able to use access to transgender health as a tool to coerce somebody to get health care. Whitman-Walker, they have a transgender health clinic too, and they will address the hormones in the transgender health. And a lot of times that works, and now I'm going, I think I'm going for my transgender health, but with the Whitman-Walker, it's such a great place that they want to address the HIV and all those things. A lot of times, I can't get my hormones, I don't want to go to it. And that's just reality, and especially in African American transgender community.
Okay, so I'm going to ask Ruby just to comment on the work she does and how she's seen the DC DC landscape change for the trans community. I know that, like THE, Casa Ruby tries to help the whole individual offer a group of services, which we all know is a better fix than offering a single service. So Ruby, if you could share with us your observations about what's been happening in the district.
Okay. First, before I forget, we're having a Thanksgiving dinner on Casa Ruby, so I forgot to mention. You're all invited to spend Thanksgiving with us from 3 to 7. It's a fabulous menu. But going back to what's also important, having, run DC, when I moved to DC in 1992, it was a different time. There was really, the word transgender was really not even, we didn't even hear it. We just kind of thought I thought I was super gay, but it turned out to be, yes. So when I decided to transition, I did it like most of us, part-time from the clubs through, it was at night. So, life taught us that, that was not something, because many of us were very courageous and will come out during the day. And then in 1995, we heard of the Tyra Hunter case. And it woke us up, because we were like, oh my God, so that means we have to go back to the nightclub. And, that's when the movement pretty much started getting stronger. And some of us woke up. And early in just, everybody throughout the city, there have been people who fought for transgender people. And in the early 2000s, that's where we pretty much got together. And I have to say, this is the reason why DC has many transgender services like no other place in the nation. Because we are a community. Now in 2012, we can actually have a conversation of what is working, what is not working, what should we improve, what do we need to do. There are many places out in this country where the conversation, people haven't even gotten together. So I see DC having changed a lot. I was there with Arlene, with a group of them, open transgender health empowerment, and I saw, the need that was there. And I was very grateful they gave me the opportunity to be there to actually learn. And we learned a lot. And, we learned that the needs were bigger than what we thought. There was so much to be done, and it was like the doors were, people were coming in. There was a lot of issues. And I'm very thankful that I also worked at Whitman-Walker, and I had the opportunity to, work not in the transgender clinic, but everything when it opened, where we have people coming to 6 services, and it was a lot, it was a lot. It's all of the time we will have people, trying to access those services. And I personally, I feel that I have evolved. This past summer, I opened Casa Ruby, and we are an agency that focuses on needs, and that's really, having my own personal needs sometimes not being met. I wanted to do something that will meet those needs. And I know I have a long way to go because, we're just open. There's been lots of, I would say, great things happening. We're soon expanding to a new location because we can't fit in there. So that goes to tell you that we have 3 floors, so that means, there's that need. And that needs to be met. So what I think is, because we do have agencies that we're working around our issues, it is time to continue working together. For the most part, early on in the advocacy that we did on trans issues, it was about violence. That is when we truly came together. And I'll never forget August 16, 2003, when 3 women were shot. One of those was my sister, Bea, and 2 African American women, one of those who did not survive. And then we realized that trans issues were not just women of color, it was everybody's. So I think we need to move on and retake that thinking. We do need to come together. We do need to support transgender organizations, and we need to come and volunteer. We need to come and be, like Debbie said, we need to empower ourselves and we need to speak up, because trust me, the work needs to continue. We have, paved the way, but now there needs to be more people coming and speaking for those issues. Because things do move forward, but sometimes, there's always more. For a long time, we had the public insurance that did cover some level of hormones, and we're now seeing that that's not happening. And what makes it worse is that hormone therapy was an incentive for trans women and trans men to come into care, because we will never walk into a place and say, I need to take care of my HIV. That's the reason why, there were new things that we were looking. What will make someone to come into Whitman-Walker, a clinic, or these places that provide the HIV care, because we knew we were dying in numbers. And there were ways that we could help, and hormone therapy was one of those, and it worked. I remember the first time the transgender clinic opened, and then people were coming to get their HIV medications. That was not something that happened. And the incentive was, we're paying for the hormone. They're not even that expensive. And, to see that going back to, or change, reversing that, it makes me very sad, because we're talking about transgender care, health. If we're not healthy with our HIV, if we're not healthy, with the way we feel inside, then we're destructive. And at the end of the day, what are we doing? And I do hope that, we're engaged in the conversation. We need to do a lot more. Sometimes, it seems like the trans activists were always bitching. It's not a bitching session, it's reality. And so I just want to share.
So thank you so much.